Well, it's when you go on the pills, one of the things that can happen when you go on the pills first is you can become very agitated, you can become suicidal, you can become homicidal, etc., etc. Or you can go drugs and things can be relatively okay. And when you try to come off them some months or years later, that's when you become agitated and become suicidal. And you kind of conclude, as my doctor told me, it's a bit like insulin. I've got a lowering of serotonin. It's a bit like diabetes. I need to continue a treatment for the rest of my life. And, you know,
Wow.
what you find when you come off the drug is you become suicidal, you go back on the drug, and almost instantly the problem clears up.
I see.
So it persuades a lot of people that, yes, that view about what's wrong with me was right, and I need to remain on these things for the rest of my life.
Wow. Okay, so I always thought like the story I always heard was, SSRI, it relates to what we talked about in the beginning, the sort of the cartoon story you often hear is, SSRIs take 6 to 8 weeks before the antidepressant effects kick in because neuroplasticity has a slow time course. And in that intervening period, you might disinhibit behavior. And that's why you get a spike in SSRI induced suicide at the beginning. But you're saying you can also get a spike in suicide if they try to come off.
Yes, and this is yes, and if you change the dose,
Hmm. Which
I
is
mean,
common.
it isn't just uh, when you actually come off; it's when you're trying to come down, you may become
Yeah.
very
Yeah.
actively suicidal. It's when you go on the drugs first, you may not have a great effect, but you may not be all that bad. You may not be suicidal, and the doctor thinks, well, you're not as good as as you could be. Let's double the dose. You can become suicidal there as well.
Mhm.
But let me throw a further thing into the mix here, which we've kind of skipped over. You may want to just drag it into the conversation. Um, you're asking me about how the companies can hide things, and we've talked about FDA and how it's easy it is to fool FDA and things like that. The other aspect to things, of course, is that most of the medical literature reporting company assays rather than trials, which appears in the New England Journal of Medicine. Actually, there's a very interesting story I can tell you about this, uh, which appears in the New England Journal of Medicine and JAMA, the various books of the Bible, and they're ghostwritten. It's
Hmm.
not just that FDA don't have access to the data in the sense of the people who are in the trial. It's the articles that companies publish have been ghostwritten. And often FDA know that the company has published an article about their trial, which says the drug worked wonderfully well and has no problems. But FDA have seen the data from the trial and not just seen the data, they haven't really looked at the data. They've been told in a covering letter by the company, our drug didn't work in this trial and it caused all sorts of problems. Okay. So FDA see an article in the New England Journal of Medicine, which is saying just the opposite. The company's written to FDA and told them our drug didn't work in this trial. It's got an article in the New England Journal of Medicine which says our drug worked wonderfully well and is free of problems. FDA know this is a fraud. Okay. But they agree. They've responded to GSK, for instance, who've written to them and said, we've done 3 trials in teenage kids, all negative. Teenagers who were depressed. All 3 trials negative. Okay. But one of them has actually been published in the leading journal in uh, child psychiatry, saying just the opposite. Okay. Uh, GSK say, you know, this trial was negative. FDA agree. We've looked at the trial and it appears to be negative. We also agree we're not going to mention this in the label of the drug. What's going on? This doesn't make FDA look awfully good. But the FDA response is it's not our job to police the medical literature.
Hmm.
And it's not. So companies can write fraudulent studies with leading names, professors of psychiatry from Harvard and
Right.
Yale, in the very best journals.
Right. Which
Okay,
enable them
now,
to submit the paperwork to the FDA, and they will process that paperwork.
well, FDA won't, no, 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 no. This is all about the marketing, the sales.
Yeah.
What happened in this particular case was the article about giving the outcome of the trial had been published before the data went to FDA.
Hmm.
It was only when the company had published the article, And there was an increasing amount of sales of Paxil for teenagers who are depressed that they thought, we've begun to realize, FDA will probably approve this drug anyway, even if, if we send the data into them, and even if we tell them the trial was negative, they're
Yeah.
probably still going to license us to say you can use this drug in teenagers who are depressed. Okay. Now, I have an interesting story which ties all of this together. There was a group of people, and you probably know, actually, you've interviewed one of them, Joe Moncrief and
Yeah.
Mark kind of Horowitz and a few other people, wrote an article for as uh, uh, for a journal called. They wrote an article for Social Science in Medicine, which is a good journal, and they have it's a bunch of journals these days, one of which is for mental health issues, and
Hmm.
they wrote an article on the lowered serotonin idea, and they looked at 20 different articles and books where there were claims that yes, there's a well-known lowering of serotonin in people who are depressed.